This is JAPI, and welcome to JAPI Podcasts.
I am Dr. Amit Saraf. Welcome to the JAPI Podcast, Volume 72. This issue has really interesting articles, which include a lot of original work and review articles as well. It has a few case reports, which I'll be touching upon. So, with that, let's discuss all these articles in detail. The first editorial we have is an update in the management of type 1 diabetes. Basically, we all are aware that it's a complex and challenging chronic condition with rising incidence in the world, including India. India, unfortunately, has the highest incidence of type 1 cases, with the number projected to progressively increase in the country. For which this particular editorial has included certain modalities by which we can try to up our management skills as clinicians. It's centric upon self management, wherein digital tools to facilitate self management in chronic disease have been seen to have a positive impact, and the development in this area has been expedited over the last year, especially with the time of COVID 19, where the pandemic made a lot of online presence a reality. Peer support in the form of unique social networks to help understanding the mutual situations of our type 1s across the country have been created. There have been 40 such peer support groups for type 1, which are available in the state and the national level, which offer to meet the various needs of people with diabetes. Newer technologies by trained healthcare professionals, such as virtual reality based education, have been used to train healthcare professionals to help reduce these complications and also treat type 1 diabetes a little better. Glucose monitoring and insulin devices, which have non invasive techniques such as real time or intermittently scanned continuous glucose monitoring system, CGMS, have been a game changer in type 1s. However, global recommendations do not always cover other populations, hence, the consensus recommendations for time in range tailored to the Indian population is now the way forward. Immunotherapy, which has been a major milestone in type 1 management, has been approved in the United States for the drug teplizumab, and it's an anti-CD3 monoclonal antibody for use in individuals who are more than equal to 8 years with a stage 2 of type 1 diabetes. That means 2 or more diabetes-related antibodies and elevated blood glucose, but no symptoms, with the aim to delay the onset of clinical type 1 diabetes. There are also other CD3, anti-CD3 monoclonal antibodies such as otelcizumab and anti-CD20 monoclonal antibodies such as rituximab, which is a cytotoxic T lymphocyte associated antigen for the immunoglobulin fusion protein, recombinant fusion protein that binds with the CD2 inhibitor of the IL-8 receptor and the antithymocyte globulin. All these are very promising molecules in the future. The other emerging therapies include a beta cell protection, which is the glutamate decarboxylase GAD, which is the enzyme which catalyzes the conversion of gamma aminobutyric acid, the GABA, in beta cells. In preclinical trials, the GABA has been found to promote insulin secretion, inhibit glucagon, and reduce inflammation, while the GAD may preserve the beta cells. Pancreatic transplant is on the anvil. It's an option, but it's challenging and not without its own antecedent complications. The routine care and patient empowerment, there is also an increased awareness of the use of psychological and behavioral interventions, which have demonstrated not only significant improvements in the quality of life, but also the care of patients with type 1 diabetes. So, such is the editorial of the JAPI volume. We move on to the first original article, which is mycophenolate mofetil with steroid, a reasonable alternative to current first-line therapy for idiopathic membranous nephropathy in resource-constrained setting, which was a randomized open-label study. This article focuses upon the modified Ponticelli regimen, which is a first-line therapy in patients with idiopathic membranous nephropathy. However, there has been less favorable safety profile seen with this therapy. Although mycophenolate mofetil plus steroid is not recommended by the Kidney Disease Improving Global Outcome Guidelines, it can be used as an alternative to the MPR due to high tolerability and steroid sparing effect. Thus, this study compared the safety and efficacy of MMF and steroid and MPR regimens in patients with the membranous nephropathy. This study included a randomized open-label study with patients with adult onset nephrotic syndrome and biopsy-proven idiopathic membranous nephropathy. 42 patients were allocated to the mycophenolate group with a steroid added to it, which was 1 gram per day of mycophenolate mofetil and oral prednisolone of 0.5 mg per kg per day. That was 21 patients. And the MPR group, with included methyl prednisolone 1 gram intravenously for 3 days, followed by alternating monthly cycles of oral prednisolone 0.5 mg per kg per day for the next 27 days, and cyclophosphamide 2 milligram mg per kg per day for 6 months for the next 21 patients were evaluated. As a result, at the end of 6 months, both groups demonstrated a significant increase in the serum albumin levels and the EGFR, with a p-value being significant, as well as decrease in the 24 hours proteinuria with both the subgroups. However, the groups did not differ in any of these parameters at any monthly follow-up visits. Moreover, the groups did not differ significantly in terms of the complete remission rate, which was 61.91% for the mycophenolate mofetil with a steroid group and 71.43% for the MPR group respectively. Thereby, this original article concluded that the mycophenolate mofetil with a steroid and the MPR had comparable tolerability, effectiveness with the MMF associated advantage of reduced steroid exposure. The second original article of this issue was a study of prevalence of renal function abnormalities and their association with the individual components of metabolic syndrome. So metabolic syndrome is one of the most important emerging pandemics of the 21st century and is associated with renal dysfunction in significant number of patients. The association of which is shown to be a greater significance, especially in the South Asian population. The aim of this study was the prevalence of renal dysfunction in patients with a metabolic syndrome as the primary outcome. The secondary outcome was to assess the strength and significance of the association between individual components of the metabolic syndrome and the presence of renal dysfunction. The method and materials used include a hospital-based cross-sectional observational study, which was conducted for 2 years in a tertiary care hospital in India. A total of 100 diagnosed metabolic syndrome patients were taken as cases and they underwent the relevant blood tests. Over a period of 18 months, 100 patients with metabolic syndrome were documented, amongst which 66% had albuminuria, with microalbuminuria being 24% and the rest being macroalbuminuria. Amongst the same subjects, 30% had estimated EGFR of less than 60 ml per minute per 1.73 square meters, a waist circumference which had the strongest association with the increased albuminuria as well as a reduced EGFR. Thereby, this original article concluded that all the components of metabolic syndrome, for example, increased waist circumference, hypertension, increased fasting glucose, raised triglycerides, and a low high density lipoprotein HDL, have statistically significant correlation with increased urine albumin to creatinine ratio and also a decreased EGFR, signifying glomerular injury and renal dysfunction respectively. The next original article was a study of evaluating inflammatory markers and demographic profile in type 2 diabetes patients amongst the ethnic communities attending Central Referral Hospitals, East Sikkim. Type 2 diabetes is the commonest metabolic disorder and inflammation plays a key role in the pathogenesis of this disease. Its ethnic variabilities have been linked with the increased prevalence of diabetes, and this pilot study was designed to evaluate the inflammatory marker demographic characteristics in type 2 diabetes amongst the ethnic group of Sikkim people. A total of 100 type 2 diabetic patients and 50 healthy controls were enrolled in this study. Demographic characteristics were recorded among patients and inflammatory markers which included high sensitive CRP, interleukin 6, body mass index, glycemic status, fasting blood glucose, and postprandial blood glucose were compared between cases and control. Inflammatory markers were correlated with BMI, glycemic status, and duration of diabetes. They found that type 2 diabetes was found to be highest amongst the age group of 45 to 55 years, with males being mostly affected. Amongst the ethnic group, Nepalis, 57% of these comprise the highest with diabetes. No significant correlation was found between inflammatory markers and BMI, glycemic status, and duration of diabetes. Thereby, the study concluded that Type 2 diabetes increases as the age progresses, with males being mostly affected. The Nepalese community showed a high proportion of the disease, mostly living in urban residences. Though they concluded that patients on statin therapy, its specific role and relationship were not in the scope of this current study, but further studies could be conducted at community level to understand the role and relationship of statins amongst type 2 diabetic patients and the possibilities of ethnic differences in the levels of biomarker due to variation in the body fat distribution. The next original article was evaluation of the SARC-F questionnaire as a diagnostic tool for sarcopenia in a geriatric age group population of the country in India. With medical science, which was advancing in leaps and bounds over the last 21st century, the average lifespan was now trending upwards, and we were now facing an increased prevalence of diseases in the elderly, sarcopenia being one of them. Unfortunately, sarcopenia, especially in India, remains to be frequently overlooked, underdiagnosed, and largely understudied. One of the greatest hindrances to diagnosis of sarcopenia is the high cost involved and limited availability of diagnostic modalities such as magnetic resonance imaging, dual X-ray absorptiometry. Accessible, feasible, affordable means to diagnose sarcopenia was thus the need of the hour. In this study, a cross-sectional observational study was done among 300 patients who were aged more than 65 years or above, including both outpatient and inpatient departments at Institute of Medical Sciences, Mulana, between June 2021 and June 2022. Patients were evaluated as per the European Working Group for Sarcopenia in Older People algorithms using bioelectrical impedance analysis, and the results were compared with the results of the SARC-F questionnaire, which was the statistical analysis carried out by the IBM statistical package for the social sciences statistics version 26. The results were, out of 300 patients, 56 were sarcopenic. Sarcopenia showed no significant association with gender. SARC-F followed a sensitivity of 73.2% and a specificity of 37.3%, with a positive predictive value of 86.51% and a negative predictive value of 32.84% in diagnosing sarcopenia. Thereby, SARC-F showed a good interreliability with Cron's-Back alpha of more than 0.7. The conclusion was SARC-F questionnaire can be used as a bedside screening tool for sarcopenia, especially in a developing country such as India, where diagnostic resources are frequently scarce. The next original article, neutrophil to lymphocyte ratio as a marker for diagnosis and prognostication of sepsis. The purpose of this article was to explore the ideal marker for early diagnosis and prognostication of sepsis, which is crucial due to the limitations of available sepsis indicators. Therefore, this study was to evaluate the neutrophil to lymphocyte ratio as a diagnostic and prognostic marker of sepsis. The prospective case control study was conducted at Tertiary Care Teaching Public Hospital. The neutrophil lymphocyte ratio values (NLR) among cases and controls were compared for diagnosis. Among cases, serial trends of NLR values, outcomes such as survival or death, and various parameters such as sequential organ failure assessment, SOFA score, duration of intensive care unit ICU stay, etc. were compared between survivors and non-survivors for prognosis. Analysis was performed using MS Excel and a PSP version. As the result was, a total of 120 patients, 60 cases and 60 controls were analyzed. The NLR was seen significantly higher in patients who were having sepsis than in controls. The study concluded that the NLR emerges as a valuable marker for both diagnosis and prognosis in sepsis, evaluated the NLR levels and diagnosing sepsis at a very early stage, and the trend of NLR demonstrated a dynamic course throughout the disease process. Persistently elevated NLR and high NLR values correlated with a poor outcome in sepsis. Additionally, the NLR can be correlated with other prognostic markers of sepsis and mortality. Therefore, the study recommended the utilization of NLR as a quick, easy, and cost-effective marker for the early diagnosis and regular prognostication of sepsis. The next original article was Evolution of Metabolic Syndrome in Newly Diagnosed Type 2 Diabetes mellitus Asian Indian patients over the last 15 years using Adult Treatment Panel 3 of National Cholesterol Education Program, World Health Organization, and International Diabetes Federation criteria. This study was recruiting newly diagnosed type 2 patients. We included from a diabetes care center from 2004 to 2019 with retrievable electronic medical data, and these were selected. The three separate timelines, namely Group 1 2004 to 2008, Group 2 between 2009 to 2013, and Group 3 between 2014 to 2019, were all selected. Overall and gender-wise incidence of various components of metabolic syndrome were also studied and compared across these three groups. The data were analyzed using statistical software statistical package for social sciences. Continuous variables were summarized by the number of observation, the mean, standard deviation of medium with minimal and maximal, and categorical values. The chi-square was used to estimate the incidence of metabolic syndrome using various criteria and gender-wise patterns. As a result, in this current study, the overall incidence of metabolic syndrome observed among study population was 80.9, 65.4, and 69.8% respectively in the three groups. A steady rise in the incidence of metabolic syndrome was observed over a study period of 2004 to 19. Amongst the components of metabolic syndrome, the incidence of central obesity, elevated triglyceride levels, low HDL cholesterol was found to be higher in the female population than in the males, whereas the incidence of hypertension was higher in males. Stringent lifestyle measures amongst the appropriate pharmacological management might help in mitigating the risks associated with metabolic syndrome, is what the study concluded. The next original article was long-term outcome of coronavirus disease associated with mucormycosis, a one-year follow-up study from India. The objective of this article was to determine if COVID-19 infection prompted the spike in invasive fungal infections in diabetic population, and also to determine the long-term outcome of COVID-associated mucormycosis, and to determine if COVID-19 infection causes diabetes mellitus transiently. The study design was a prospective cohort study comprising of patients suffering from mucormycosis. It was planned from 2021 May until November 2022, and it followed a long-term follow-up of 1 year of mucormycosis patients. The participants of this study were consecutive patients who were admitted to this particular hospital for treatment of mucormycosis. Interventions for clinical trials, exposures for observational studies in all patients suffering with mucormycosis underwent treatment at the hospital with surgery and injectable systemic antifungal along with diabetic management. The results, the data of 98 participants were collected, but analysis were done after excluding the cases of cutaneous mucormycosis. Mean age for the patient was 55.5, varying from 28 to 88 years of age. In this study, 63.3% of patients with mucormycosis were males and 37.8% were females, of which 55.7% and 58.3% were known diabetics respectively. Previous history of diabetes mellitus was identified as an underlying comorbid condition in 56.7% of patients, while the rest were diagnosed as a new onset of diabetes mellitus. Thereby, as a conclusion comment, this study has proven that diabetes mellitus, particularly with a poor glycemic control, was the single most important factor associated with and a predictor of outcome of COVID with mucormycosis. Contrary to the popular hypothesis, industrial oxygen and oxygen masks were not the reasons for mucormycosis pandemic. Additionally, the immunizations against COVID provided protection not only from severe COVID, but also from COVID-associated mucormycosis. The study recommended that patients with mucormycosis should be followed for a longer duration of time, as fewer patients could be suffering from transient diabetes, particularly against the background of a pandemic. The next original article, addition of mask to high-flow nasal oxygen, a strategy to improve oxygenation in hypoxemic respiratory failure secondary to COVID-19. The purpose of this study was high-flow nasal cannula was known to reduce the need for invasive mechanical ventilation in COVID-19 patients with hypoxemic respiratory failure during HFNO treatment in room air, which dilutes the delivered fractionated inspiratory oxygen, which thereby prevented the improvement oxygenation. The placement of a mask over the HFNO to improve oxygenation was proved to be conflicting results. Thereby, the study was aimed to determine and compare the effect of placing various mask types over the HFNO on oxygen saturation. This was a prospective physiological study of 40 patients with COVID-19 associated hypoxemic respiratory failure with oxygen concentrators of less than 92% to begin with. The results included a significant higher mean SpO2 and other mean respiratory rate on using various study masks over HFNO compared to HFNO alone. On comparing various mask types, the use of N95 mask and non-rebreathable NRB mask with O2 showed significant increase in the O2 concentration and reduction in respiratory rate as compared to surgical masks and the non-rebreathable without oxygen masks. To conclude, the study demonstrated an improvement in oxygenation and reduction in respiratory rate with the use of various masks over HFNO in patients with COVID-19 related hypoxemic respiratory failure. Significantly higher benefit was achieved with the use of N95 or a non-rebreathable mask with oxygen compared to plain NRB without the oxygen supply. The next original article, statin usage in peripheral arterial disease patients. The objective of this study was that atherosclerotic cardiovascular disease (ASCVD) events have been shown to occur at high frequencies in patients with a peripheral vascular disease. In this study, the aim was to evaluate whether statin being used appropriately in patients with peripheral vascular disease and to also evaluate its usage with the number of vascular beds involved. The data from 166 patients who met the inclusion criteria was taken. The mean age was around 63.34 years. Multiple logistical regression analysis were applied, and the study concluded that despite having high risk of future adverse cardiac events, patients with a peripheral vascular disease are less likely to receive appropriate statin therapy. Involvement of more vascular beds was associated with a higher chance of initiating high intensity statin. The next original article was declining trend of antimicrobial sensitivity in the respiratory tract bacterial pathogens against commonly used drugs at a tertiary care hospital. This study, the objective was to determine whether antimicrobial resistance was a major issue in health, also to determine the trends in bacterial organisms in the respiratory tract and their antibiotic sensitivity at a tertiary care center. As a methodology, successful samples were received from Jan 2017 to December 2021 from respiratory tract, which included sputum, endotracheal secretions, and bronchoalveolar lavages from ICUs and medical inpatients, and they were processed for bacterial growth. A total of 7,204 respiratory samples were collected. A significant bacterial growth was in 3,000 of them, and 2,999 were gram-negative Klebsiella pneumoniae as the most prevalent organism, followed by Pseudomonas aeruginosa, Acinetobacter baumannii, Escherichia coli, and Enterobacter aeruginans was seen as the most common organism in the decreasing trend. As a concluding remark, this study has proven that common respiratory tract gram-negative bacterial pathogens at a tertiary care hospital are Klebsiella pneumoniae, Pseudomonas aeruginosa, Acinetobacter baumannii, and Escherichia coli. All these bacteria demonstrate high sensitivity only to colistin and polymyxin. Significant antibacterial resistance was observed to carbapenems, tigecycline, aminoglycosides, and third-generation cephalosporins. Secular trends also showed declining antibacterial sensitivity amongst various bacterial pathogens. The next is a review article, which was an Indian expert group review of acanthosis nigrans with recommendations for early diagnosis and timely management. The objective of this review article was to review the published current literature and evidence of acanthosis nigrans, its association and management. It was also to recommend an approach for clinical identification of acanthosis nigrans, associated or underlying disorders, investigations and management, including lifestyle modifications. The PCOS Society of India constituted a multi-speciality expert working group with representation from various national societies to review all published scientific evidence. To conclude, the acanthosis nigrans was a simple, non-invasive, cost-effective screening tool for early identification of insulin resistance. It is important to integrate and disseminate information and training on acanthosis nigrans across various medical specialties. The Government of India has launched several national health programs to help address the rising burden of non-communicable diseases in this population. Acanthosis nigrans would provide a simple screening tool to pick up undiagnosed or missed cases. Next, we have a point of view on chronic obstructive pulmonary disease and oxygen therapy, a double-edged sword. Oxygen, like all medicines, is a drug which needs moderation. Hypoxia, as well as excess oxygenation, can be harmful to a patient with chronic obstructive pulmonary disease, COPD. Both the European and British guidelines recommend a target oxygen saturation of 88 to 92% in patients with COPD. Hypoxia can result in symptoms such as restlessness, anxiety, agitation, headaches, whereas excess oxygenation can also lead to altered sensorium due to retention of carbon dioxide. In patients with COPD, we often come across patients who come with breathlessness and have hypoxia, and a knee-jerk reaction is to start the patient on oxygen support to maintain his oxygen saturation more than equal to 95%. This may result in hypercapnia and a type 2 respiratory failure. Thereby, this review was a descriptive analysis of proper application of oxygen therapy in patients presenting with acute exacerbation of COPD and the rationale behind target oxygen saturation and the mechanisms of type 2 respiratory failure due to hyperoxygenation. Thereafter, this issue of JAPI has interesting case reports. First one of them was the primary aortoenteric fistula due to Salmonella typhi related mycotic aneurysm. The next was a post-dengue acute disseminated encephalomyelitis. There is also a case report upon surgical management in the medical emergency, disseminated extensive tissue damage due to snake envenomation. There is also a case report on neuroparacoccydoidiomycosis, as well a case report on the adult partial anomalous pulmonary venous connection, which was include a case of scimitar syndrome. That brings to the conclusion of this podcast. Thank you all for listening to JAPI Podcast.